Welcome to America's Heroes Group.
Welcome back to America's Heroes Group, this time with a roundtable on our partner, National Nurses United. Today is Saturday, April 15th, 2023, April Sexual Assault, Minority Health, and Autism Awareness Month. Our host is Kelley. I'm Sean Claiborne, the co-host. Our executive producer is Glenda Smith, but filling in Shakaya today, and also our technical director and our studio engineer, doing all three hats today. And our digital media producer, that's Ivan Ortega of Scout Turner Productions, and also the master of all things technical here in the studio. Our partner, Adelena Marshall, she's a VA mental health RN, and she's going to talk about depression and mental health. What are we going to talk about today, Adelena?
Well, we're going to talk about depression and mental health, and I don't know if anybody viewed CNN today, but they did have a big presentation on mental health and how it's affecting nurses, as well as the general public. We've all been through a very trying times in the last few years and been isolated due to COVID. Things are lifting now, and people have kind of lost their way. They've lost contact with their churches, with their friends. Many of them lost friends and family members during this crisis. And it's starting to affect them. And we're starting to see the impact of what the last few years has done to the population.
Wow.
So what I'd like to do is just to make your listening audience and our veterans, their family and friends, to be mindful of signs and symptoms of depression. And if someone that you love or you're around, try to get them the help that they may need. Sometimes it's only you sit there and talk to them and invite them out, have some social contact with them, and that might help. But if someone is depressed for an extended period of time, they're not doing their usual, maintaining their home, interaction with other people, loss of interest in things, even intimacy, all that can be a sign of depression.
So walk us through those different, the things you just mentioned, walk us through those different things. Because sometimes people they might not really see or understand or be able to recognize those different symptoms. When they actually are seeing them, they might say, oh, that person is just being quiet today, or that person's a little shy or whatever. Walk us through what each item might be, the big ones, and then how we can recognize those things.
Well, everybody has a blue day, everybody. Even mental health staff. But this goes beyond that. So this goes beyond somebody just having a bad day. They're a little grumpy today. I'll catch up with them later. They may be grumpy. But if you're starting to see a change in their personality, if they're starting to push away from things that they normally participate in, if they're not showing any interest in eating, I mean, I've just had someone like that that lost weight because they have no interest in eating. And what was dangerous about that was that they were also diabetic and on diabetic medication. So it was important that they eat, and they had isolated themselves. So you start looking for those symptoms. If somebody normally goes out, say, bicycle riding, and they're no longer interested, or they were attending church even if it's on Zoom or something, and now they're not doing that. You can miss a couple of weeks or something, but when you start seeing a pattern, and depression builds up. So if you have depression episodes, it may resolve itself. But when you see that it doesn't, and each time you have another episode, you tend to have a more deeper depression that will affect you. So those are things that, anything out of the unusual, wow, Adelena don't seem like her normal self today. Let me reach out to her and, see if she wants to talk about anything. So you can do that. You can pick up the phone and call somebody. Hey, I've been thinking about you. Let me holler at them. Mm-hmm. Just stay in contact. And if you feel that they're not going to work, if it's affecting their life, their daily activities to an extent, then they may need to go see a doctor.
So the key thing I keep hearing is that a change in behavior overall. So when something is bothering someone, when it starts to affect their normal activity or their daily life, that is probably a red flag for maybe depression or something else is going on in their life.
Right. Low energy. Some people just, I just want to sleep for a couple of days. I'm just so tired. Well, if it's not a medical issue, it could be from depression. And if they're just laying in the bed and it's gone past a few days, sometimes people just burn out and they need to vegetate. That's okay. But if they are just not coming out the house anymore and just isolating, they may be starting to have some problems with depression.
A lot of people self-medicate. They drink maybe, or they'll even take medicine or take drugs. What would you say to a person who's around someone like that because a person might think, I don't have an addiction, I don't have a problem. How do you identify when something is a problem when a person's using something to self-medicate?
Well, you're absolutely right. Many people who suffer from depression may self-medicate thinking it's going to make them feel better. But if anything is occurring out of the usual, if they are, maybe have one or two beers on the weekend, that's one thing. But now if they're buying liquor and staying in the house and drinking and isolating, or you see that their drinking has increased and you become worried about it, then listen to your inner self that they may be having problems. Even for people who use drugs, sometimes they do try to self-medicate, and those who haven't started, we'd like to discourage them for doing that and to reach out and get some support that you may not have had.
One of the things I've learned and I've noticed and I've read about over and over again, a lot of the stories I'm hearing as veterans get older, they if they're having some depression, they're drinking more often as they get older. They're drinking more in their older age years than their younger years. Have you seen anything or heard anything about that?
Yes, we do get veterans because as they get older, their friends may have passed. They no longer have their fishing buddy or their bowling buddy and things like that, and that might end up they might then feel that they need to have a drink just to get through the day. But I can even say recently we've had older vets come in due to depression. I think the isolation too from COVID has affected them. But the weather is breaking. We're encouraging people to get out, increase your interaction, reach out to the families, and the families reach out to your veterans. If you haven't heard from them in a minute, don't let life get in front of caring for your loved ones. Sometimes you just have to stop, or you know what, I'm going to take off a few hours today and just go by and sit with my dad or my uncle. Bring them their little favorite snacks and just talk about old times. And sometimes that may be enough just to get them going.
I've noticed also too that in the media, particularly with politicians, it seems to be a hot topic where they're taking mental illness more seriously. We've had an election here recently here in Chicago, and the candidates, one more so than the other, were talking more about mental health and also using professionals to help treat mental health issues. So when someone calls 311 or calls 911, you're not just sending a police officer out to the home or to the incident. You're actually taking a step, taking a beat to actually analyze the situation and send the right type of person, which may be a mental health professional.
Yes, and I agree with that, and I support that. But I also don't want that to become a cliche. Like every time there's an election, it's about helping our schools and helping our children, and then once they get elected, but people have to hold them accountable. And we do need more mental health in the schools and earlier intervention. And when people are calling 911 for a loved one, even if they have a mental health issue, I think it's a good thing to identify that in that call. That, my loved one has been treated recently for depression or is under treatment for mental health. And that way, the people who respond will become more aware and be able to maybe handle that person in a different way. But, it is coming to the forefront. We have to get more mental health specialists trained. And one thing I can say about Jesse Brown and the VA, they also have mental health support in the hospital for staff. Sometimes the staff gets very overwhelmed. And our patients, I think they view us as the ever-ready bunny. We just keep going. But when we have, I think one thing about the VA, we know our patients. We see the same patients over and over again. And when something happened to them, we are affected also. It's like us losing a family member or a loved one. And so they are now acknowledging that. And work overload, as CNN stated, there's 100,000 nurses that are leaving the workforce. And it's everybody says, well, hire more, but they're not out there to hire. So that means added responsibilities for those that are still there working and working at bedside. Many of the nurses who are leaving are not leaving nurses. They're taking more lucrative jobs in private sector and insurance companies and telework. And it's difficult to continue to work at the bedside when you don't have the staff to support you. And that's not just RENs. We need health techs and we need LPNs, and the nursing homes need health techs. So there's a big crisis in the medical field. And I just want to encourage the patients when they come in, just be mindful that the nurses and the staff are doing the best they can for you. I have nurses will not leave a patient's bedside if that patient leaves them. And that's part of our union model, is that we are going to care for our veterans. Is the veterans come first before any of our self-interests.
I agree. Now, do you think it's a good idea to train, because as a nurse, speaking from your experience as a nurse, to train nurses and also maybe even paramedics, people that work on ambulances, to have some kind of mental health training? Or do you think that's putting too much on their plate?
No, I think actually I even advocate at our own facilities for the staff to have more mental health training, even those that work in mental health. We need more training. Things are happening so quickly. Medication changes, drugs that's out in the street that affect the clarity of our patients change. So we need constant education on what's going on out there. And how do you identify this, and then how do you work with that? And another thing nobody's looking at is geriatric sites, because many of our veterans are aging, but they still need psychiatric care. And that changes as they start to get Alzheimer's or dementia.
And that's one of my biggest fears and concerns about our aging population with veterans, is that you have a lot of veterans that are by themselves, or they're alone. Like they
are alone,
like you mentioned, or they might be going through a situation of depression because their wife passed away, and maybe that was the one person in their life that understood them, or they could tell stories to, or be honest, or be kind of vulnerable to. And then now that person's gone, and then they're self-medicating, they're isolated, their mental capacity is diminishing as they get older.
Right. We do. The VA does provide home health care, and they go there and they help the patients set up their beds. And for us, before our patients are discharged, we do a lot of education with them so that they can, be aware of the meds, recognize the meds that they have. But I tell you one thing that nobody is addressing is when they change the distributor of the medication. The medication doesn't change generically, but the color of that pill may change, or the shape of that pill may change. And I would encourage our patients to tell the doctors to write the orders to be very specific as to what they want, because these drug companies make a lot of money. And so when they change the medication, not the medication you're on, but who's distributing that medication, it's like, oh, okay, well, now we can get it for so-and-so a little bit cheaper. Well, that causes our patients to lose trust. And then say they're taking a green and yellow pill for 20 years, and now the same pill, the same dosage, but now looks a lot different. And they don't recognize it. And in the older population, that's a flag for them. Well, maybe I shouldn't be taking this, or why are they changing it? So this is something else that politicians can address.
Wow. So because the medication itself changed, the appearance changed. A lot of people. I can understand that. In all honesty, they're taking care of my mom. Because even when you're trying to give someone medication, you're used to seeing the big yellow pill or the little blue pill and all this other type of stuff. But then if it changes, you're like, okay, did I get the right one? Did I do that one today? Did I do that one yesterday?
Right. That's exactly what they do. And if they're starting to have early signs and symptoms of Alzheimer's or dementia, that'll be a problem because they don't recognize that med. So when we talk about the politicians, they're out there saying things, but they're not talking to our nurses and people at the bedside who can educate them and let them know some of the things that do affect our patients and their health.
Seems like we need more people in professional situations, professional industries, like more nurses and people in the healthcare industry, in politics or in government, maybe, so they can understand and address these issues. I wish our Congress was more diverse, instead of having a bunch of lawyers that are in Congress just writing, laws about stuff they know nothing about. Having more people that understand science, understand medicine, understand economics, understand finance and banking, so they can make better laws, they can make better decisions, and understand what they're writing about. I remember I had one politician tell me one time, he was had a position here in Chicago, and he said that you don't need to know anything. You just you have guys that we pay that they're like the experts, and they just tell us what to know. Well, if you don't understand what they're saying, you're not very effective at your job.
Right. That's the people that's coming from these big drug companies that don't want a change because they're making all this money off of the public. They do pay these lobbyists to come there and lobby for them, but the public needs to lobby and be educated for themselves and say no. I mean, if you're having a medication, a distributor, and that medication looks different, you should be able to ask whoever you're getting your meds from, Walgreens, Costco, Walmart, anybody, and say, no, I want what was just filled in my last prescription. Because if they keep changing it, you lose interest and you don't want to keep taking it.
Wow.
And that's very important in mental health, very important for blood pressure meds. There is life-saving medication out there that should not be changed.
Now, where are the nurses and government, the Title 38 employees, where are they at as far as their fight to being able to try to change or argue or to lobby for collective bargain for better wages, better working conditions in the government health systems?
Well, as we spoke before, there is a 7422 law that keeps us from being able to bargain for a market rate salary. There's another reason why we have problems recruiting nurses and keeping them, and especially more junior nurses who don't have anything to lose by leaving right now. They're not vested in the VA, and if somebody across the street is going to offer them a higher salary, that's where they're going to go if the work environment is better. And while we're discussing this, one thing that is very concerning to me is to have management teams who do not have the experience that the floor nurses have. Oftentimes, they'll put people in management positions, say over I won't call out any specific thing, but say dialysis.
Mm-hmm.
But you have a business manager running dialysis versus a manager who is proficient in dialysis and, certified and all these other things. So you have staff that are more educated and more experienced than some of the middle management.
Wow.
And this is something they need to look at, because this is another way we can keep our nurses. I should be able to go to my manager and ask a question, or, talk about maybe an unusual situation that's occurring and talk about it so we can come up with the best treatment plan for that particular patient.
So you have middle managers that aren't really even medically trained. They're trained in business or management per se. Maybe they have an MBA or something like that.
Some of them maybe, or they could have a background. Say maybe they got a background in psych, but they're managing a med-surg area, something like that.
Wow.
And that's not working with the more junior nurses. They're very smart. They're highly educated. The education level now is a lot for a nurse, for somebody to become a nurse. So they're going to question things. And again, we become very attached to our patients, and we want the best for them. And the union, anybody in a union hospital will know that that's what we do, is advocate for patient care above salary or anything else. But in order for us to maintain staff, they have to overturn that 7422.
Mm-hmm.
Another thing I could say, over at Jesse Brown, we have started alternate work schedules. So that hopefully will go a long way to maintain some of our nurses, so they can get an extra day off during the week, or extra day off every other week, or some of them can even get 2 days off extra a week.
But that's the one thing I don't understand. Why do hospitals make doctors work like 2 days and 3 days in a row? That makes no sense. I don't understand it. Why is that in the system? Why do doctors and nurses have to work these crazy long shifts? Why not just have 3 shifts like every other job?
Well, the staff don't really want 3 shifts. I mean, we do have 3 shifts. We have morning, we have evening, we have night. So nobody has to work more than 8 hours. Okay. It may seem that way to the public, but nobody has to work more than 8 hours. And especially at the VA, they have laws that you cannot work more than 12 hours. They cannot mandate overtime like in private sector. There's a lot of things that is law. You can't work more than 60 hours in a week. A manager cannot schedule you 60 hours. They can only schedule you for 40 hours. So we have laws that protect our nurses in the VA, because at one time they were doing that, and they're doing that in private sector. So we don't want that, because we don't want fatigue. We don't want the negative impact on your family. We all know of stories where nurses are work, and they can't take care of their families because they're not home. And so we want a life balance in the medical field.
So why is it happening in the private sector? Why is the private sector doing it?
Because the private sector does not have those laws. But the one thing in California, they do have staffing ratios, which we do not have it here. We need to get it in Chicago, and there's been talk about it. But these are things the politicians can make happen. But they're just resistant, because the hospitals, the private sector hospitals, they have also people that are there and talking, are in the ears of these politicians and telling them no. But we need staffing ratios. That doesn't mean that if I'm scheduled to take 5 and for whatever reason I might have 6 patients, doesn't mean I can't do that. But that should be the exception instead of the norm.
Mm-hmm.
Like yesterday when I was leaving work, literally there was 3 codes called within 30 minutes.
Wow. Is that danger? How dangerous is that?
That's dangerous, because we got teams that have to, respond to those codes. And if they're at one code and another code happens, then that's going to pull nurses from the bedside to have to go there. Everybody drops. So if you hear a code announced, everybody stop and they try to listen where it's at, and if they need to go there to help that person survive that code.
Well, So what do you see in the future? Do you see things getting better, or politicians starting to kind of understand and get the idea of, first of all, getting more professionals in to help with depression and mental health, but then also making better decisions and smarter laws and legislation to address the issue?
They have to do all of the above. They have to open.
Are they starting?
Programs.
Do you see them starting that conversation?
I think maybe in the last few months, and with the elections coming up, you're hearing more talk about it. When you think about when these shootings are occurring, also, when they have to take those patients to the hospital, this is an emergency. That pulls all your staff, and if you have limited staff, that's gonna chances of survival is gonna be decreased. And so there's a lot of things in the community that these politicians need to address. And when it boils down to is you still have to have staffing, you still have to have trained personnel, you still have to have educated people to fulfill all of these things that you're talking about. So you need to open programs. We need health tech. That's maybe a 6-week course. Why can't you run some of those courses in the evening if you got people who's willing to train them? Maybe they get off from Jesse Brown and go over to Malcolm X and have a class from 4 to 8, or something, or 5 to 8. So they can leave their one job and come over there and get trained and then get into the field. These are jobs that move people from a lower into a higher economic status.
It's all about training, that's for sure. And if you don't have the training, it's hard to do the job. It looks like
right. And these are not where you got to spend a lot of money for education. Many times we get health techs or LPNs that want to become RNs, and they're already good at what they're doing. They know all the basics. So now we just got to get them into that next position, okay?
Adelena Marshall.
They may have a job during the day. Let's do something in the evening that can support them, or on the weekend, on a Saturday.
Let's
get creative.
Thanks for your time and also giving us the information, because everything you're saying is really important, and we want to hit this issue and this topic more often because mental health and depression is something that's very serious. And we'll talk to you soon. Public
start demanding enough staff to care for you. Thank you.
This is America's Heroes Group, Game Changers. If you want to reach out to us, we have a website, americashd.org. Make sure you go to the website, see our archive shows, and also check us out on YouTube and Facebook. You also, if you want to leave us a message, we have an email address, info@americashd.org. That's info@americashd.org. It's also on their screen if you're watching on our podcast. So listen to our podcast, get the information, be more effective, be healthy, be safe. This is America's Heroes Group. We'll see you again next week. Same time, same place, 4 to 6 p.m. every Saturday.